So welcome everyone. We are really excited to welcome an incredible panel of speakers this evening as people continue to roll in. Unfortunately, punctuality is not one of the Wise Wellness Guild's strong suits because we are always rushing off to place, and so we like to give a little bit of grace. But I have a feeling that tonight's conversation is going to be quite full, and we'll probably just use all the time tonight, so I'm going to go ahead and get started. This event this evening is something that I have been dreaming about since I started Wise Wellness Guild. Talking about our bodies, talking about what is normal, what is not normal, and just really having frank conversations about ourselves is something that is incredibly taboo. Even with my closest girlfriends, I sometimes really have a hard time having the conversations and asking the questions that I need to ask. And even going into a meeting with my physician, I was actually at the Christ Hospital today with Dr. Lana Lang, and I found myself kind of fumbling over asking questions about things that I needed to know for my annual visit. And I think that part of that comes from just holding a lot of shame for not knowing and acknowledging that what we have is beautiful and completely acceptable and normal. And so tonight's event is all about just that. It's about embracing ourselves, having comfort in understanding our bodies, and understanding about that it's okay to have this type of conversation. It's getting rid of the taboo and getting comfortable with being uncomfortable until it's not even a conversation anymore. It's just dialogue that we can casually have. And a little bit about me, my background. I spent quite a few years working on brands like Always and Always Discreet, where I had the great fortune of working on the Like a Girl campaign, where we really tried to start to debunk and demystify periods for women, and understanding that girls' confidence plummets at the age of 13, but a lot of times when it comes, in conjunction with when they have their period. Then I moved into Always Discreet, where I learned a lot about adult incontinence. And 1 in 3 women actually experience adult incontinence. 1 in 9 do anything about it. So I'm very comfortable in having conversations about things that are not really sexy to talk about, okay? And I think that this evening is, I will push us. And so if you don't want to be pushed, that's okay, but I'm going to push us as a group to push a little bit more to ask the things that you want to ask. And so the rules of the road this evening, before we get in, I just ask that everybody, if you're not speaking, please go on mute to just avoid background noise. I ask that you do be brave and put questions into the chat. And if you want to, you can come off of mute and you can ask the questions. This is intended to be not necessarily your traditional panel discussion where we go and ask questions and it's in order. This is meant to be more of a roundtable style. And so I would really appreciate everybody on the call contributing their different thoughts, either through the chat or just jumping in and saying something that comes to you. So tonight's conversation is intended to be not your mother's breast health discussion, if you haven't already taken that away. We will talk about facts. We will talk about things that are science-based. That's all a part of the Wise culture, is that we are always curious and learning and wanting to lean into more. But we will do it in a way that is fun and it's exciting. The world is really heavy right now. We all do not need any more negativity in our lives. But what we do need is we need reality, right? We need a dose of reality. So tonight is about having real conversations and diving in, but having an absolute blast. And so I'm thrilled and honored to be able to bring this group of amazing women from across the region tonight in partnership with the Christ Hospital, who, as many of you know, we recently announced our partnership that we are forging forward with a new membership level, Prosper, where we'll be offering healthcare, virtual visits, as well as all the best of Wise, and a quarterly subscription wellness box that gets you all kinds of goodies, but the really exciting thing is medical grade skincare products, ZO, that comes inside of that. So all personalized for you. If you have any questions, I'll answer them towards the end, but the Christ Hospital has just been an incredible partner in this space. They're my health system of choice, and so couldn't be more proud to announce that. So let's go ahead and dive into what's going on tonight. I would love to introduce you to our amazing panel of speakers. The first is Ashley Basius, and I will go through these, and then I would love for each of them, once I say everybody's names, for you to just go through and just share a little bit about why you said yes to this event, because you could have said no to spending your Thursday or Tuesday evening with me. So I'm really grateful. Why you said yes, and then, you know, what are you the most excited about what you're going to speak about tonight? So Ashley Basius. Ashley and I met through Procter & Gamble when I previously worked there, but Ashley and I also share a background in fashion design. So not many of you know that I actually went to design school here in Cincinnati, and you're thinking wellness, design. Well, the beauty about designers are that we hone in on a very specific problem usually. We are problem solvers. We try to get to the core and root of human insight and make people's lives better. And so Ashley, after coming from her fashion design background, it only made sense that she transformed her career through Procter & Gamble and working in design as a leader there. The next is Dr. Kelly McLean. So Kelly is an incredible breast surgeon at the Christ Hospital. She has an incredible reputation and patient scores, which, you know, for me is something that I really look to make sure that, you know, anybody that is representing WISE in the Christ Hospital, and we're partnering, and she's just blown me away with the things that people that she's worked with, and especially her peers and colleagues. Kelly comes to us from University of Michigan, and she studied surgery residency at the University of Cincinnati. But what I love is Kelly has really integrated wellness into her life. And we know as healthcare professionals, it is very difficult a lot of times for you to find balance and time to do that. And I really appreciate that you've prioritized that in your life and can be a role model for so many other women who, you know, make excuses about why they can't do things like kayaking and playing tennis and doing things that allow for us to invest in things that matter. One of the really cool parts that I thought is that you spent a lot of time working with a no-kill cat shelter, which I would love to hear more about, because I think that when we talk about living into our purpose, I think it's amazing that you help humans, but you're also helping our feline friends. So that's really, really incredible. Micky is an all-around inspiration, BA woman, mom, yoga instructor, survivor. And the piece that I love about Micky and why she's, you know, here tonight is because she has taken her diagnosis, taken her circumstances, and transformed them into an incredibly positive outcome in Micky's Tiara, which she'll tell you more about. And I think that her energy just will jump through the screen. I have no doubt that you're going to have an incredible girl crush on her like I do. I feel like I've been watching her journey from afar for so long, and it's just a real privilege and honor to have her here. And then last but certainly not least is Brianne, if she wants to be formal, Bree Bavara, who she comes to us from Fifth Third. She's a wealth management advisor, but she, for me, introduced me to the Karen Wellington Foundation. And if many of you don't know about the Karen Wellington Foundation, it's about living with breast cancer, and it's allowing for people like you and I to contribute to experiences for women who are, when they're going through the experience and making their lives better, and those around them's lives better. And so I'm just always so grateful that Bree introduced me to this great organization, and she's here tonight to just share a little bit of insight from a perspective of how you can kind of get involved, and how, you know, you make sure that when it's this time of year, and the other 11 months of the year, how you can really support somebody who might be going through a really tough time, whether it's a family member, friend, all of that. So let's go ahead and jump in. Ashley, do you want to go ahead and just introduce yourself a little bit and share a little bit about, why you said yes and what you're excited about? Oh, you're on mute. Classic. Okay, great. I'm asking you to unmute, so we'll see. This is, just like, it really is hilarious. There we go. Hey, girl.
What about now?
Hi, perfect.
Okay, thank goodness. Otherwise, I was going to have no idea what was going on. Cool. So, why did I say yes? You mentioned, Stevie, that I started in fashion design, and even when I was in school doing that, doing things for women and helping women has been something that's been so important to me. Like, even in school, when I got super into lingerie, the lingerie industry is very interesting because, kind of at that time when I was in school, most of lingerie felt like it was very sexual. And I was like, where's the lingerie that's designed by women for women? And so that essentially started my love for it and started my journey of where I am today. And so I worked in the fashion industry a bit doing that. I also worked at Knickers of Hyde Park, which is where I learned how to fit bras, which is what I'll be talking to you guys about today. And then it's kind of been a nice segue into my journey into feminine care now at Procter & Gamble, because like you mentioned, there's so much tied to periods that women experience that, at least more people are talking about it, but for a long time, people were not talking about it. So I feel like my life's work is to just help ladies out. And so I'm so excited to be here to talk to you guys today.
Oh my gosh, well, thank you so much. I'm really excited to dive into your content. I know you have a really great presentation for us, and you're going to be debunking a lot of myths. So that's wonderful. Thank you. All right, Dr. Kelly McLean, tell us a little bit about why you said yes this evening and a little bit about what you're excited to chat about.
Hi, my name is Kelly McLean, and I'm a breast cancer surgeon here at the Christ Hospital. And I'm going to be talking about myths about breast care and breast cancer. And it's amazing to me how I see people from all walks of life, all kinds of backgrounds, all ages. And there are some common misconceptions that people come in with that it's just are pervasive. And so it's exciting to just be able to talk about them and then talk about some things that are true and some simple things that we can do to reduce our risk and improve our health.
I love that. Well, thank you so much again. I know that your time is incredibly valuable, but I also know that this is something you've dedicated your whole life's work to. So I'm really, really grateful to have you here and your expertise. Micky, thank you so much for joining. Your smile is so infectious already. I'm just like, it's just so great to have you here. And I would love to hear why you said yes. I know that you are, raising young ones and really diving in with this. So tell us more about why is Wellness Guild?
Absolutely. Thank you for having me here. Hi, everybody. Good to see you all. As Stevie said, I'm a breast cancer survivor. I was diagnosed at the age of 31. I am raising two young ones at the time. My daughter was 5 months old and my son was 2 years old. And of course, my whole world changed at that time. And what do you do when your body has to change and you don't have any control over it? I had to go through chemo. I had 16 rounds of chemo. I had a bilateral mastectomy. I had a reconstructive surgery. And this was important for me today because I basically had to fall in love with myself all over again, my new body. And even though it was different, it was very empowering to go through that process and to love myself at all stages. So for me, women's health is important. I've now become an advocate. And you mentioned the Karen Wellington Foundation. I'm also an ambassador now on their survivor board. And that's how I kind of created Micky's Tiara, which we'll talk about later, to help empower women and encourage them to embrace themselves and be happy and comfortable. And I love that you picked this topic that's so taboo sometimes, but really it should be put in the forefront. And we should be proud to be women and embrace ourselves and love ourselves and love our bodies. So thank you for having me today. I'm so excited.
Gosh, well, thank you for joining us. And Bree, would love to hear from you this evening. Thank you so much for joining us. Uh-oh. I'm going to ask you to unmute. There we go.
Okay, can you hear me? I have had the jokes upon jokes because I am a millennial and am the worst at technology. So I am historically on mute, and so thank you for bearing with me. I'm Bree Bovara. I'm a wealth management advisor within Fifth Third's private bank. I head up our women's wealth management strategy at the bank, just noting that there aren't many female financial advisors out there. In fact, I think 86% of financial advisors are male, and women make up over 50% of the population. So got involved with Stevie through our Sea Change cohort, and we're ready to change the world as females who want to empower other females. And really why I'm here is through my involvement with the Karen Wellington Foundation. I did not grow up in Cincinnati, and when a mentor of mine at Fifth Third found out that both my mom, my grandma, and my mother-in-law are breast cancer survivors, they said, you've got to get connected with Kent Wellington, who founded the Karen Wellington Foundation for Living with Breast Cancer. And it was really the vision of his late wife, who fought breast cancer for 10 years. And she said, you know what, my goal would be to deliver one vacation per year to a family who really needs some fun on their calendar. And that's what the foundation is all about. And now we deliver hundreds of vacations per year to families that are going through the breast cancer journey today.
Amazing. And I know we'll talk a little bit more about it. And it's, again, certainly it's an option that I personally love, because I really do think that the, mindset and giving people a reminder of what living feels like and what it looks like can be so much about overcoming your challenges. And so I'm really, really excited. Well, I know we're going to be diving right into this topic. So I'm going to go ahead and present. Ashley has graced us with an awesome presentation just to aid her topic. And so we will go ahead and dive in to the first part of it, which is all about bra styling and getting into some of the construction methods and some of the science behind something that you may or may not wear every day. I know I do. And so Ashley, do you want to dive in?
Yeah, let's do it. Just checking you can hear me again.
You're all good.
Okay, cool. Awesome. And so what I'm going to talk to you guys about today is kind of from the fashion industry perspective and a fashion designer perspective. But my main mission is to empower you with this knowledge so you can get more comfortable with knowing your body and knowing your bra size. So you can take it or leave it. This is not, you have to do this. But I at least wanted to share this information with you so you're armed with it next time you go shopping for a bra. So Stevie, if you hop to the next slide. So, and kind of like one of the ways that we'll be doing it is we'll be talking about myths and kind of busting them. And so myth number one is most women know their bra size. But the fact is that 70% of women are wearing the wrong bra size, which to me, when I first found out this statistic, was mind-blowing. This is most of us, right? So if you go to the next slide, this is kind of like bra anatomy. And as we go through this today, slides are my favorite. I'd love to have a conversation, but because there's so much information, I wanted to give you guys some pictures so I don't lose you along the way. So this is kind of your bra anatomy and 101. And I've got an underwire bra on the screen. But this applies to most bras that are out there in the market, different styles. I just kind of wanted to use this one because it's easiest to see all the parts. And so we'll start with the cup. Most people know what the cups are. They're, the two round things in the front. Straps, most of us know what straps are. A band, that's the part that goes around your rib cage. If it is an underwire bra, there is a wire. So that is essentially enveloped in that like tube of fabric that you see under the cups. Most bras have a closure, and they're typically on the back. Again, many different styles. We'll get into that in a bit. And then the last little part of the anatomy that I'll talk is like a terrible name. I have no idea why it's named this, but it's called the gore. And it's that tiny little piece of fabric that sits in the very front and center of the bra. And this, even though it has a terrible name, is a very important factor when you're trying to find a bra that fits you properly. So if you go to the next slide, the second myth is the support comes from your straps, where the fact is actually that the support should come from your band. And so if you hop to the next slide, let's talk a little bit about what this means. And so one telltale sign of a band not fitting properly is if it's not straight across your back. So the woman in the larger picture with the gray bra, you can tell that her band or the back of her bra is essentially straight across her back, which means that it fits her really well. It's snug on her body, but not too tight. That's essentially her anchoring point and where all the support for her breast is coming from. Whereas like if you look at the smaller picture of the woman in the white bra in the upper right, you know, we've all either experienced this or seen it on someone through the back of their shirts, right? If you see kind of this frowning situation for bras, that essentially means your band is too loose, which is causing it to ride up and cause kind of this frowning shape, which means you're not getting the support that you need. So if you hop to the next slide, and it got, I don't know if it's just my screen, but it got a little, there we go, perfect. Now it's perfect. And so another top tip, so when you're talking about your band is when you're buying a new bra, and if it has a closure, you want to make sure that your closure fits properly on the loosest hook. So you can see in the woman on this photo, it's on the loosest one. And why that is because all materials of all garments have a shelf life, just like food. Elastic has a shelf life as well. And so over time, the elastic will essentially lose its elasticity. It won't be able to recover as well. So when it stretches out and gets older, you want to be able to move it into the middle hook and then to the third hook. So as the elastic doesn't recover as much or it's already stretched out, you want to be able to tighten your band, makes your bra last longer. And then this is also the main part where you get your support. I have a lot of conversations about this in particular with people about bralettes, because like in the past 5 years, bralettes have like taken the US by storm. Now we live in the land of COVID and bralettes are maybe the most comfortable bras out there. So lots of people are wearing them. And so if you haven't had luck with bralettes, like I hear from a lot of my friends that have much larger cups that they definitely don't work for them, that honestly just might be the case in the end. But also if you haven't tried a bralette with a really substantial supportive band, that might be something that you want to give a shot because it might help you find a bralette that's right for you. So then if you go to the next slide, let's talk a little bit about straps. So now that we know that your support comes from your band and not from your straps, let's talk about signs of how we know that the straps probably aren't quite right for you and what you should look for to make sure that they are right for you. So a strap, the purpose of a strap is really just to keep all of the different parts of the bra in shape on your, or in the right place on your body as you move. And so if the strap is digging in or if it's too tight, like that image on the upper right, that's a telltale sign that you've either tightened them too much, but more likely it's that your band isn't giving you the support that you need, and then therefore the weight is now resting on your straps. So if your straps are digging in or if it's leaving marks on your skin, that's a sign that something is up and you've probably got the wrong size bra. And then another sign that your straps aren't quite what you want is if they're too loose. So you can see the image at the bottom. Like I know I've been victim of like I'm wearing a bra and with a tank top and then my strap falls out the side. And it's like, oh gosh, like now everybody can see my strap and I know it's not doing what it's supposed to do. So that's also a telltale sign that your straps aren't quite what you need them to be. Personal story really quick, like such a bummer. I went to this, if you guys have heard of Third Love, it's a new company that's out there and they have this system online where you can essentially input a bunch of, answers to questions to get you the right bra size. But they had a pop-up when I was in New York City, and I was just like, oh my God, I'm so excited. I can't wait to go. So I went in and, I found this bra that fit really great in the band, fit really great in the cups, but in the straps, it fit fine. But I noticed that it was on like its tightest setting, if you want to call it that. And so I couldn't adjust it to be any tighter. So I knew, speaking again about like shelf life of elastic and how things just wear out over time, I knew as soon as I started wearing that bra for a week or whatever, that strap would become too loose for me and I wouldn't be able to tighten it anymore. So you want to make sure when you're shopping for bras as well that it's not too tight, it's not too loose, and you're able to tighten it as the elastic wears out over time. So the next myth, there's no way that I can be a D cup. But in fact, and this is like a little, I'll say I took a little liberty on this fact, it's that your boobs are probably bigger than you think. And so there's so much conversation out there about what cup sizes mean and like all this bull, I'll call it bull. But basically, everything that you've thought about sizes for bras, I would honestly throw out the window because there's just been so many misleading things out there. And so for me, and I'll share a personal story a little bit later, I know that I had this realization when I went on my journey of finding the right size bra for me. So let's talk a little bit about cups. Cups can be too small, cups can be too big. That's usually, either one of those is more common, obviously, right? 70%. So I want to share with you how you can get your cups just right. And so if you look at this woman on the right, the telltale sign that her cups are too small is that her underwire on her left boob, I'll call it, you can tell as it comes up towards the front in the center, you can see where that wire is literally pressing on her tissue. And if any of us, I know I have, if any of you have worn an underwire bra like this, you know that like, not even by the end of the day, like 2 hours in, you are feeling this thing and it feels terrible. It is like seriously painful. And so you don't want the underwire to be on top of or pressing into any of your breast tissue. And we'll talk about that a little bit more in a second. If you go to the next slide. Another telltale sign that you don't have the right cup size is the dreaded quadriboob. And this happens to anyone, whether your boobs are small or big or somewhere in between. Like I've been a victim of quadriboob many a time on my journey to learning about this. But it's typically a telltale sign that, again, your cups are likely a little bit too small. And then kind of, on the other end of the spectrum is, are my cups a little bit too big? So if you look at the image on the right, you can see that there's space between her breast tissue / her chest on there. In the fashion industry, we call that gapping or gaping. And so that can happen when you're standing there just like she is, or if you're bending over and moving, if you have space in there, that's kind of a sign that your cups are probably too big. And so this slide, this is like where my dorkiness comes out for bra fittings. Like the bra on this woman, she is like living her best life in the best fitting bra ever. And so let me tell you a little bit about how you can tell that. So we talked a little bit about the underwire at first with the other image with it like digging into her boob and it looked terrible. And we knew it would feel terrible later. And so you can see from this image that the wire is not on her tissue at all. It's in the center of her chest, not pressing on her tissue. And another important thing that I found through my journey that a lot of women don't know is like the side of the underwire. You want it to go around all of your tissue through the side of your body. So you make sure that it encompasses the tissue on the side of you as well, because it doesn't just sit in the front. And typically from a placement standpoint, it's like if you were to continue that wire up, it would hit you in the center of your armpit. So for a lot of women, it's a bit further back on the side of their body than they would expect. But you can kind of see from this photo where like that wire is essentially heading to the center of her armpit. And you can see all of her tissue is kind of enveloped. Going back to that terrible name of that centerpiece of fabric, the gore, this is when the gore comes into play a little bit. So you can see that centerpiece of fabric is flat on her chest And that is great. That essentially means that her cups are the right size. If her cups were too small, then that piece of fabric would probably be raised a little bit, which would cause pressure on her tissue, and it would affect your band, which is your whole, main thing for support. And so those are kind of the main things to look for as you look for a good fitting bra. Okay, so here's a myth that I encounter all the time, and it was so frustrating for me before I learned about it, and like why it wasn't working. But the myth is, if I'm a 34D, then a 36C will work just as well for me, right? So if you go up in band, you can go down in cup size, and it's like the same. But the fact is, when you go up in band size, we just talked that you're losing support. So a couple things can happen from that. So you can get a different look than you want if you like a really supported look, or even worse, because you're not getting the support, it can cause discomfort and pain if you have larger breasts, particularly for your back. So this is a big myth that I'm very excited to bust today, because I've been a victim, let me tell you. So if you go to the next slide. So I'm talking about all this, and you're probably like, okay, cool. So how the heck do I find my bra size? So this was very mind-blowing for me. As I mentioned to you guys, like when I first started my lingerie journey way back in the day, this was probably 12 plus years ago at this point, I learned how to fit bras at Knickers of Hyde Park. That's where I worked. And this is where I learned this. And then, again, I'll share my personal journey in a moment, but my mind was blown. So how you do it is you take a tape measure, if you have one, and you measure around your rib cage right below your tissue, and that number in inches is essentially your band size. And then you take the tape measure and you measure around the largest part of your breast tissue, and you have that inches number. And the difference between the two is your cup size. So for example, if you have a 36-inch rib cage, but your tissue is measuring 38 inches at the largest point, you have a difference of 2 inches. So based on this chart, the difference of 2 inches is a B cup. That means you're a 36 band, because 36 was your rib cage, B, so 36B. Sometimes it's really hard and daunting to do it for yourself, at least I think. So another great option, and I'm definitely biased, but I truly think it's a great suggestion, is to go to Knickers of Hyde Park, because they do really great fittings. And they do, when I was there, we didn't necessarily measure you. What we did was we literally looked at you, and then we thought, okay, she's probably this size. And then we got you different bras to try on. So it's also a little less invasive. So if you don't want someone to be around you with a tape measure, then that's another way to do it. And I swear they don't pay me on the side. You go to the next slide. So here's my personal story. This is me. We're on camera. We're not in person. So you only know what I look like from the chest up. But this is what I look like my full body. And so, it was such an interesting thing for me to try to find my bra size. So when I was in high school, the most common bra size that I heard about in my sphere was 34B. So I was like, okay, maybe I'm a 34B. I'll start there. I have no idea. Nobody talks to you about this stuff. And so I went on that journey, and not even getting fitted necessarily, but going to different stores and trying different bra sizes. And I thought I knew what I was doing. / I was too embarrassed to tell people that I didn't know what I was doing. And so then when I finally started working at Knickers, it was like, okay, I'll measure myself and let's see what's actually happening. And technically, based on how they measure, I'm a 28E, right? What the heck is that? When has anyone ever seen a 28E in the store? I can tell you that I have not. And so that was such an eye-opening thing for me. One, because this is a size that I had never heard of. Two, you can tell from this picture, my boobs are pretty small. So how the heck, back to the earlier myth of I can't be a D cup, is this even true? And so, once I kind of went through this journey of doing all of the fit things that we just talked about, making sure the wire hits in the right place, making sure the band is giving me the right support, and the straps and the centerpiece of fabric is flat on my chest, I was like, oh my God, this is my size. This is mind-blowingly comfortable. I feel so much better. I look better in my clothes. Like, I can't believe I was doing that before. And so now, because obviously they don't sell 28E in stores, back to that whole, if you go up in band size, you can go down in cup size. I found my sweet spot at this point in my life is like a 30D or a 30C.
I think that that's so interesting. And Ashley, I know we talked about even like vanity sizing too. You know, there's like this idea, I know this concept of like E, like sounds like crazy, right? And then like, I know like I have had friends that are like, have been fitted and they've been G's, and there's like all of this shame that comes from it. And it's like, oh, I feel huge, like I have to hide them. Like, and I think that the reality of it is it's just like the conversations we're having about jeans, just like conversations we're having about like different body shapes and different body types. Like, it's your body. And like, that's what it is. And we need to just start accepting where we are, because the reality of it is, the way I think about it is, if you're, you know, a size 12, and which is a beautiful size, but you don't want to be in a size 12, you want to be in a size 6, you squeezing yourself into those size 6s and trying to put them on, you're going to get something probably around your hips. You're going to be so uncomfortable. It's probably going to cut off your circulation, right? It's no different than, you know, jeans. And so I think that as you think about your bra size and what you're wearing, that's my big message, is that be empowered to kind of know what size you are. I know for me, I've been to the point where I've had, you know, my underwire, you know, rubbed me raw and I bled. And because I just wanted to fit into that like Victoria's Secret semi-annual sale bra that I just had to have because it was on triple discount. And it's so embarrassing to think that I would do that to myself, you know, because at the end of the day, it's so distracting. I mean, that I would do that to my body. So I think that there's a lot that we can really learn in terms of just like embracing, like, this is what it is, and how do we help get you and guide you to the right place. So awesome.
Yes, I love that. Here's some more top tips for finding the right size. So you're not the same size forever. As women, lives change, lifestyles change, we have children. And so it's good to get refitted every now and then, just to make sure that you are looking for the right bra size so you can be comfortable, to Stevie's point. And then once you know your size, like I suggested to go to Knickers, for example, if you find your size there, you are not, you know, you have not signed a contract to buy a bra there. But now what's great about that is you have empowered yourself with the information of like, oh, hey, this is my size. And if I can't find any bras in you know, the style or whatever that I like at this place, now that I know it, I can go look at other places. In Cincinnati, if you like shopping in the stores, Knickers and Nordstrom do a really nice job of carrying a wide range of sizes and styles. And then also those kind of like, you know, sizes that you don't typically find in the store, like mine, like a 30C, I can't find that everywhere. So Knickers and Nordstrom have extended sizes. I also used to work for Aerie in their lingerie design. And so this is also a plug for them. But what they do is like, they're very affordable. And they also carry additional sizes online. So again, once you get armed with the information of your bra size, it's kind of like the world opens up to you a bit. Bras typically last about a year. This obviously depends also on how much you wear them and how much you wash them. But like we talked, just like food, elastic has a shelf life. So typically after 1 to 2 years, it will no longer recover. It will no longer come back. And so that time plus like body oil from wearing your bras and then also washing your bras takes a toll. And then I know from a laundering standpoint, this is very annoying, but I will at least share with you why all the tags say not to wash your bras or dry your bras, I'm sorry. And it's essentially because the heat of the dryer damages the elastic more quickly. So elastic is made of spandex and the heat can compromise the spandex. And so that's why basically whenever you buy a bra or anything with elastic, it kind of says, you know, hang to dry, lay flat to dry. So if you do that, it will extend the life of your bra versus if you put it in the dryer. And then the last thing that I'll leave you all with is, like I said at the beginning, this was information and how bra design was intended to fit on people. Take with it what you will. This is not a mandate that you have to do this by any means. The most important thing is that you're comfortable and you find what is right for you. There's so many different bra styles out there, so many different brands. And like I was saying earlier, it's definitely a journey to find what works. But when you do, I can tell you that the feeling is incredible. Like, you just know, you feel better. You look better in your clothes. You're not in pain anymore. So I hope this was helpful today for you all as you move along your journey of finding the right bra.
No, and I love this, Ashley, because it allows for us to, there's so many other things coming off of this, right, that we could talk about. One is, let's definitely all go burn our bras still from high school and college, because I will tell you that I still have those in 9 different homes, I think, at this point. So
I was just going to say that the year-long lifespan, that's embarrassing. I think I have bras from the 8th grade.
100%.
Very bizarre, and I probably should throw all of my bras away at this point.
I'm with you, sister. Oh my God.
To each their own. I do too. It's not, like I said, not a hard, steadfast rule, but technically.
Yeah, absolutely. And I think that there's so many other questions that I think we'll probably do a follow-up Q&A with Ashley on, from I have a lot of questions around like lining and shape. Like, I know sometimes I'll get a bra that I really like and fits everywhere, but it makes me look like they're pointing outward and weird shapes, and I don't know. And we've talked a little bit about lining and about acceptability of THO and nipple coverage, and in the Midwest it's less acceptable, cleavage is less acceptable, but in on the coast it's everybody just kind of has their chest out and it's totally fine. So I think that there's a lot that goes into I want to eventually get into the conversation of culture, and my whole philosophy on patriarchy and the way that people kind of sexualize breasts and all of that. So I think we can probably hold off on that topic because we'd be here for another 5 days. But if anybody, I would love to dive in and kind of transition this conversation into with Dr. Kelly McLean on, a little bit really debunking some myths specifically on our breast health, and talking a little bit about what are some things that we know that I had some people submit questions ahead of time, but I wanted to be able to just kind of kick off and have Dr. McLean share a little bit about some of her top things that she's heard, things that she kind of finds surprising that people don't know, or kind of your favorite myth to debunk, I guess.
So transitioning, the very first myth that I'm going to debunk is that wearing bras, particularly underwire bras, cause cancer. So that is not true. There was a small study that done, I think in the early 90s, that suggests that women who didn't wear bras had lower incidence of breast cancer, but that's probably a reflection that if you have smaller breasts and you're thinner, then you can get away with and you're more comfortable not wearing a bra. And so it's probably a reflection of other characteristics that do lower risk of breast cancer. So certainly wearing a bra with an underwire does not cause cancer.
Oh, that's so great. And I have heard that one before too. I remember when that myth was really rolling around a couple of years ago.
The other go along with that is that implants do not cause breast cancer either. Some of the things that are associated with it, though, that can sort of increase the risk of cancer. So having any biopsies or breast surgeries does slightly increase your risk. It's probably based partially in that if you're having surgeries, then there's something going on in your breasts and your mammograms that prompt that. But it also, any surgery or biopsy causes inflammation, and inflammation definitely can be one of the nituses for cancer anywhere, because then you get cells that are under stress and are replicating, and then the errors in replication happen. But so implants themselves do not cause breast cancer. There is a cancer called breast implant associated lymphoma. So that is real. It's also not very common. The incidence varies, and what you see reported, like 1 in 3,000 or 1 in 30,000, it may even be less common. That is not subtle. So it is usually something where you start noticing physical changes in your implants. There's a firmness around it. There's a pain associated with it. And usually that is quite curable by removing the implants and the capsules associated with it. So that's myth number 1.
Yeah, that's great.
So myth number 2 that I wanted to address is that, so patients come in that I don't understand. No one in my family has breast cancer, has a history of cancer. I was tested, I did 23andMe, I was tested, I don't carry the BRCA gene. How can I have cancer? I can't have cancer. So breast cancer, the most common cancer in women next to skin cancer. So 1 in 8 women, that's 12% lifetime risk, 1 in 8 women will get breast cancer. About 75% of women who are diagnosed with breast cancer do not have a family history. And genetic changes only account for 5 to 10% of people who get breast cancer. It's a very common, sporadically occurring multifactorial disease that has many things that influence it. Which makes it important to get regular screening, whether or not you have a substantial risk factors or not. Now, that doesn't mean that if you have a family history, or if someone carries a gene, that you're not at an increased risk, and there certainly are increased higher, what we call high risk screening modalities for people who have a family history or a gene. So the normal lifetime risk of developing breast cancer is 12%, so 1 in 8 women. If you have a lifetime risk of greater than 20%, then you can consider doing high risk screening. And so that includes screening with both mammograms and MRIs, staggering them every 6 months, and getting a clinical exam at the same time. So most of the major hospital systems have what's called a high risk clinic, and they're usually staffed by nurse practitioners, and there are very standardized protocols for imaging and for regular exams for people who have an increased lifetime risk. So mammogram, oh, go ahead.
I'm going to say, in terms of even getting to like that number, so I'm kind of taking a step back and I'm saying, okay, is there some sort of like screener or test that's available that I could take?
Yeah, so there are multiple different risk calculator modalities. The most commonly used ones are the Tyrer-Cuzick ones. They tend to take a lot family history into account, and breast density. That's been a big new hot topic, is including breast density. Other things that are taken into account are age of menarche and age of menopause, if you've taken any hormone replacement, if you've had any breast biopsies, if any of them have been atypical. So most breast practitioners belong to the American Society of Breast Surgeons, and they have, as part of their tools that are available, a risk calculator. So so you could Google like Tyre Cusick or Gail or Klaus. Most family practitioners probably don't have access to those calculators, but any breast surgeon, anyone who specializes in breast care will have access to it and can calculate that for you and family members.
Okay, so I think we can send that out to this group as a follow-up and make sure that that's available, because I think that if you have questions, I know that I've always get a lot of questions within my family circle on, when's the right time to start getting mammograms, and if you have family history of breast cancer in your family or not. There's a lot of different questions, so I think we can definitely provide some more clear guidance so that way people know how to understand their risk. I think that's awesome.
Yeah, so many of the mammography suites, so the screening programs where you go to get screening are now, there's a bunch of questions that you answer when you go in, and there's some that set off red flags to calculate lifetime risk. So for instance, at Christ, we just started our high risk clinic, and when you sign up for your mammogram, there's a chat box that you can fill out that will tell you about that and offer a referral to the high risk clinic. So I think that a really good way of finding out about it is when you go in for your mammogram, asking about a high risk clinic.
No, and that's helpful. And I want to ask Micky, when we get to telling your story, I mean, 31, I know the recommendation isn't traditionally to get a mammogram and at that age, and so I think that that's the piece that will be interesting. I would love to make sure that you share that part of your story, because I think that is there anything that we can kind of learn from. So that's awesome. Go ahead.
Oh, so mammograms pick up 85% of breast cancers. MRIs, which the high risk screening, are more sensitive and can pick up to 95%.
That's great.
The other thing to keep in mind is that right now there are 23 genes that we know of that put people at an increased risk for developing breast and GYN cancers. So it's not just about the BRCA genes, there are other ones. And so if you have a family history, if you have breast cancer yourself, or you have an elevated lifetime risk, there are genetic counselors available to guide you in having a comprehensive test. So the BRCA 1 and 2 genes stand for breast cancer 1 and 2. They were the first genes that were discovered in 96 and 98, but since then we've learned so much more about genetics, and there are so many more things to know.
That's fantastic. No, because I think there's definitely major stigmas around that too, that it definitely means there's some people that are like, you're definitely going to get breast cancer then, right? And I think that that's also a myth there of you have options, right? And there are things that you just working with somebody, not panicking, but mostly just understanding your options.
Yeah, definitely. And very individualized. What one person considers empowering, another person considers anxiety provoking. So, it's what I always tell people is it's my job to tell you what's medically sound, and it's your job to tell me what fits into your life, what's right for you now. And that may change.
Absolutely. I think that's great. And as people, I know one of the things that I'm always curious about is, if people are doing their exams and they find something, I know that I'm guilty of this. I've been known that during my, when I'm getting ready to have my period, my cycle, my breast will start to hurt. And this is an every month thing that I'm like, oh my gosh, something's wrong, and so I am kind of curious, what do you see is like some of the major kind of false alarms, like pretty common things? Because when I do look it up, it says, guess what? It's fairly common for your breast to be sensitive sometimes. Like that just happens. Like that's a part of hormones and stuff like that.
Yeah, so breast pain in general. So I'll preface this by saying that I would rather have someone come in with a false alarm where I say that's completely normal than have someone think that something's stupid and not come in.
It's a great philosophy.
In general, breast pain tends to be something external acting on the breast. So, hormones, so just cyclical, birth control, medications, caffeine, tobacco, marijuana, so substance use. So it tends to be, unless you can pretty much say this spot right here, fibroadenomas, cysts, exercise. So actually the pec muscle sits right behind the breast. And that sometimes musculoskeletal actually feels like breast pain.
No, that's fantastic. Because I think that that's also like just being aware and paying attention. Oh yeah, by the way, I did lift that 60-pound table.
Right. Yeah, exactly.
Meaning that like you don't lift every day and that's a thing that happened. But I appreciate erring on the side of asking a professional, empowering yourself to reach out. I do know that through the Christ Hospital, one thing that I think is really kind of cool is we have access to Janet Ferguson, who's a nurse navigator, and you guys have this really cool thing through WISE. Well, it's for everybody, but we really promote it through WISE. You can pick up the phone and call her directly, and she can kind of give you, instead of going down the rabbit hole of WebMD, like I do every month, or going down and kind of self-diagnosing and working myself up. It's nice to just talk to somebody, and she can always find the right path for you if it does sound like you need to meet with somebody. And I just find that to be really reassuring because, like I said, until I became a mom, I really wasn't worried about a whole lot, but now I feel like I over amplify everything. But it's okay, because having that conversation, sometimes it is something that it's worth just quelling my concerns about. So Janet's just been really, really amazing in helping me personally. And it's something that I really like to promote for our women at WISE.
Yeah, no, I think that's huge because a hospital is a black box, and you don't know, you're like, I have this issue, you don't know where to go, how to really get through, who to go to. And so to have a contact person for like women's health is very important. Similarly, Lisa Shelton is our nurse navigator for breast cancer. And so she follows all of the biopsies that go on in the Women's Center and contacts anyone that needs either a surgical consult or has a breast cancer diagnosis and helps direct them to the right resources. Because that's, of course, a time where you don't want to, you need to know where to go. You don't want to waste any time.
Well, I think I love having that additional resource. And I just, like I said, I literally feel like it's my life, part of my life path and journey is to empower women to really start to and take care of themselves and really advance themselves through wellness. And that self-awareness piece is one that I think is just so crucial. Having autonomy, taking ownership over your health, I think it's part that I know I have outsourced for so much of my life. And I'm really starting to regain control again and understanding a little bit more about what I want to do. If I want to have a future, I have to be aware of, what I'm literally feel like I'm crawling right now because I've been like, they'll tell me if my blood pressure is off. Like they'll tell me if like something looks wrong. And it's like, well, no, actually, like working in healthcare now, I recognize that you're driving the bus, sister. Like you've got to really be, in control over this. So I think that's amazing. I know we're running up on time. I knew this was going to happen. So I would like to ask you a question that came from Bree was, is there a correlation with breastfeeding and breast cancer?
Yeah, so breastfeeding can reduce your risk of developing breast cancer, and it probably has to do with that it suppresses hormones, and certainly lifetime exposure to hormones increases your risk of breast cancer. So that's early menarche, late menopause, taking hormone replacement afterwards because it's a longer period of time where you're exposed to hormones.
That's great. And then similarly, in terms of risk, it's been really interesting kind of asking people. There were a lot of questions on like diet and consumption. So around alcohol consumption and linkage to breast cancer, and then milk consumption. Um, there's a correlation between breast size and increasing estrogen. Help us debunk that. I'd heard the alcohol, I'd never heard the milk.
Yeah, so unfortunately, the alcohol one is not a myth. It is true. So we used to say that in moderation was okay, and that 2 to 3 drinks like a day was too much. Now, actually, studies say that no alcohol consumption is ideal. I don't think that's probably completely realistic for everyone, and I don't think that people should feel guilty if they have a glass of wine. But it's the maintain it in moderation. And the reason that that's probably true is because alcohol affects the liver, and the liver is what metabolizes estrogen. And so acute consumption of alcohol can change the enzymes and the metabolism in the liver, and certainly long-term consumption of alcohol can structurally change the liver and create cirrhosis and which suppresses the metabolism of estrogen and in general raises estrogen levels.
And then what about milk? I'm just so like.
So there aren't very many other dietary things. So I don't know specifically about milk, but my suspicion is that we're talking about the hormones that are given to animals. Sugar, soy, milk, in general, there's no support saying that they increase breast cancer, that in general, we don't consume enough of them to have that be an overwhelming effect. On the other side, diet in general can decrease your risk of developing breast cancer, and it's not a specific diet in general, but it's the maintaining a healthy body mass index. So that's 25 or less. Reduces your risk of developing breast cancer, particularly if you're postmenopausal.
Okay.
So the diet I personally recommend is the DASH diet, which is the diet to alleviate systemic hypertension. It's very similar to the Mediterranean diet. And basically it's common sense, eat whole, non-processed foods, a wide balance of them. And you don't have to, I think that people, while it's not impossible, I think that people who are, that you don't have to be a vegetarian. You can still eat meat, certainly seafoods, but it's eating that in a wise amount because it's a good protein source, but it's also a saturated fat source.
Yeah, that's fantastic. I have been dabbling with the Mediterranean diet, just with WISE in general, trying to, I ebb and flow is what I would say. It's so interesting because during the beginning of COVID, I was like, I'm going to eat the best. This is going to be it. I'm going to get into it. And I think that what the piece for me is, with developing any new healthy habit, it's just consistency and making sure that I'm committed to the why. And I think that it's not about necessarily losing weight. It's not about necessarily, I think even if people focus on their BMI too much, that the end goal is about being really healthy. And the fact that not being so regimented, and I feel like I was probably being too regimented and trying to focus on, you've got to be the pinnacle of health. This is it. And I think it's okay to say, I'm going to work it into my diet, and I'm going to make sure that I'm drinking enough water, which, and all of that. When you get one thing in balance, usually a lot of other things follow it. So that's fantastic. Well, are there any other questions? I know that I really want to hop into asking Micky and asking Bree a little bit about Karen Wellington, but I want to make sure that any other myths that we debunk, I think there'll probably be some other questions that I have when Micky starts to tell a little bit about her story for Dr. McLean.
I have a question for Dr. McLean. So I don't know where I heard this from. Is there any correlation to like fragrances, candles, or like the Febreze, those type of things, and breast cancer? I think I was at a conference one time and somebody mentioned it, and I didn't get a chance to ask about it at the end. So I've always had that in the back of my mind. Like, is that true?
So I can't actually, I'd have to look it up to make sure that I was being accurate, but I haven't heard of a correlation. So there's some, I haven't heard of a correlation between fragrances, but I would have to specifically check to confirm that.
I was just about to blow out the candle behind me if you were going to say yes. I'm like, oh shit, this is my favorite time of year to have all the fall candles going. Now I can't have any. You're telling me no wine and no candles, Kelly. Come on.
The Mediterranean diet does allow for red wine because the antioxidants and stuff in it.
There we go. That's why I selected it.
I'm glad you haven't heard of that correlation. That makes me very happy.
Bated breath. No, that's great.
While you guys are talking, I'll look it up.
Well, that's awesome. I love that. Well, so Micky, I would love to hear about, your journey, because like I said, 31 for me is definitely the youngest that I've ever heard. And so tell me about how you even came to understand your diagnosis, and just share with us a little bit about your overall journey and philosophy of kind of like how this happened, because I don't know you very well at all, except for what I've seen, and you seem like a walking ray of sunshine, and it's very it's just so inspiring for me that I'm sure that it's it's a choice. So would love to hear more about your story.
I definitely think that we are put here for a reason. I've always been a firm believer of that. And so for me, when I got diagnosed at age 31, I also believe, like, in order to love who you are, you have to embrace every experience that you have, even if it's not what you would prefer. Would I have preferred to get breast cancer? No. But what's come out of it definitely has given me a new perspective on life and just myself in general. It was interesting that Dr. McLean talked about, the facts when she mentioned family history and age. I don't know anyone in my family on either side that had breast cancer. And I did get tested for the gene. I was negative. So it was shocking to me at 31 when this just all of a sudden occurred. At the time, like I said, my daughter was 5 months old, and I was breastfeeding, and I was having a horrible time at it. And I was producing on one side and not on the other. And I went to lactation consultants. I tried everything, and it wasn't working. And it wasn't until I went into a follow-up appointment with my gynecologist that I had felt a lump, and I mentioned it to her. And she was like, it must be a clogged milk duct. That's maybe why your milk's not coming in. But I think you should, see a breast specialist. And thank God I took the referral. And I ended up having a mammogram. And that's kind of how I found out. And another thing that I think Dr. McLean talked about was, or maybe it was you, Stevie, the mammograms, you're usually told to get them at age 40 and over 40. And age it's almost scary. And this is just in the Cincinnati area. So I would highly recommend getting your mammogram even in your 30s, because a lot of people don't know that. So I work at Children's Hospital, and a lot of, can you all hear me? Sorry, it's saying a lot of times your job will cover mammograms. So it'll be no cost to you. A lot of people think it's a big thing. Most people's insurance, it is covered. So after I got diagnosed, I actually was treated at the Christ Hospital. So Dr. Robert Cody was my oncologist there, and he was great. The whole staff there was great. And I had 16 rounds of chemo. Then I ended up having a bilateral mastectomy, and then I had a reconstructive surgery. And my type of cancer, it was invasive ductal. So it was in my milk ducts and in my nipples. So I had my nipples removed. And I recently just got nipple tattoos. So that is like this last kind of, I want to say the last part of my journey, but something that I've been very excited about and happy to have, because it's just something I wanted to do for me. And that was going back to what I said at the beginning, as embracing yourself at all phases of life. And, you know, whether you want to lose weight, gain weight, whether you're not feeling the best or wherever is, you just have to embrace where you are. And so during my journey, I started Micky's Tiara, which is a platform that I use to empower and inspire women. I actually documented some of my journey on YouTube. I blogged about it. I started doing yoga during my chemotherapy, and I was so inspired with yoga that I decided to become an instructor. So I went to school for a year afterwards and got my certification there. And then I've also made partnerships with a lot of organizations. So I am a patient ambassador at the Christ Hospital. I've done a lot of work with them, as well as Young Survival Coalition. I'm a peer mentor for the Pink Ribbon Girls, which is another organization in Cincinnati, and Karen Wellington Foundation. I'm now on their recipient ambassador board. So I'm kind of like a go-between with a lot of organizations. I like to connect women to what they need health-wise and mental, and also just support there if they need a shoulder to lean on or talk to, because I've been through a lot. And you know, I love to help women overcome and get through those things. And even with it's like body image or mental health or physical health, whatever it is with the yoga, that's kind of just what my zhuzh is. So definitely, yeah.
You've been so honest and forthcoming about your journey to self-acceptance.
Mm-hmm.
That when your body betrays you, right, and your body can do things, it's something that can feel, it's a choice. You can feel resentment or you can feel acceptance. And I think you've really stepped into this space of saying, this is the new, better version of me, because this is the only version that I have. And I'm so excited to hear about your latest tattoo. I think that that's awesome. For censoring purposes, I won't ask you to show us. But I think that's awesome. I recently kind of heard, I had heard about it, but I feel like it is becoming more prevalent. Is that something that's offered at like a regular tattoo shop, or is that something that you go to a specialist for? What is that? Where is that done?
So they typically do them at a specialist, or you're referred to some place that does it. I mean, they may do them at tattoo shops, but I don't know. The person I went to, her name was Christina Siegel. She has a, she is in Columbus, actually. The reason that I chose her is because, as you all can see, I'm African-American, and there's a lot more that goes into nipple tattooing than just your regular tattoo parlor. It's not just like, here's some red, here's some black and white, and here's a picture. It's actual making it look 3D, and then also combining the colors to get it to where it looks natural. And so she has a lot of experience with women of color, and just in general. And so based off her work that I've seen, I was willing to make the drive, and she did not disappoint. So yeah, it's definitely something that's coming around, I think within the last few years, mostly for women after, if they have to have their nipples removed. There's a reconstructive surgery you can have done, but this is just now another option. And for me, that's what I wanted to do. And they look so real. I wish I could show you all.
We'll get everybody.
Yes.
Exactly.
But it really looked like you were just looking at me. You would not be able to tell that it's really flat. They look 3-dimensional. And so it's just really cool, like how they're able to use the ink and mix the colors together to make it pop and really look real.
And how did you find out about this woman in Columbus? Did you hear a referral, or within the African American community were you kind of referred to her?
So I actually found out about her. I have a group, we call ourselves the Breasties. It's 6 of us, and we always share information. All of us are survivors, and all of us are under the age of 40, and we're all in Cincinnati. And we share information when we get it. And I think somebody had passed her name along in the group, and a couple of us were interested in doing it. And I was like, they were like, well, somebody needs to go, so one of us can see. And I was like, I'll do it. So yeah, I think that's just how it happened. But I had a long conversation with her about it, and she explained. And then when I actually went there and how much technique it goes into it, I mean, it's really cool. It's really awesome.
That's amazing. I love that you just took ownership over it and kind of said, this is what we're going to go do. So, I mean, I know you're involved with so many organizations, and with Micky's Tiara, I want to hear more about how people can engage with your organization. Like, what are some of the things that you kind of see? How do you see it growing? How can we become involved? What looks like help?
Definitely want to grow more in the yoga field and health and wellness field. I was teaching at a studio here in Cincinnati locally, but since COVID, it's been kind of difficult to do that and stay safe. So that's definitely something I want to be interested in. Definitely, if anyone ever knows anyone who is diagnosed with breast cancer and needs to talk or needs to vent or whatever, you can refer on my way. My email is mickystiara@gmail.com. I do blog. So I think the last blog I did was actually about yoga. And so you can visit my website, mickystiara.com. Right now, I've been more focused on being a mom. My son is in virtual learning, and I don't know if anybody knows anybody who's doing that. That takes up a majority of my day. So definitely want to get back into blogging and yoga, and hopefully one day I would love to continue to partner with the Christ Hospital. I've done gift bags there, so continue to do that and just support women who have breast cancer.
Well, I think that's amazing. And I definitely, one of my big missions with WISE is that we don't relegate these conversations to just 1 month out of the year. I mean, there's another 11 months to talk about breast cancer and heart health, and have conversations on things that really do impact us. And it's not, it's not like a commercial thing. It's like really actually a meaningful conversation about this. So I hope that you're up for it, because I definitely think that, continuing to have this dialogue and creating space for that, I know that they very much value you as an ambassador. And so I think that that's really incredible, Micky, and looking forward to continuing to partner with you on this. One thing that I did want to talk about here in the last few minutes with you and Bree is around the Karen Wellington Foundation, because so much of the work that you're doing right now is all about helping women understand that, living with breast cancer and embracing the changes that their body is going through is so much about the, better outcomes and results. And so can you share a little bit about your experience with Karen Wellington and why you've decided to stay on as an ambassador for them as well?
Yeah, so I never heard of the Karen Wellington Foundation until I got diagnosed with cancer. And actually, one of my good friends nominated my family to be a recipient, and I didn't know she did that. And when we found out, I always say it like this, like I was just so shocked, like there's really people out there that are willing to give your family an experience or a vacation. I couldn't believe it. And it's true. The Karen Wellington Foundation, from start to finish, they're an amazing organization. They sent our family to Disney World in 2018. We actually had a donor give us their timeshare. And so my family got to go there. We went to 3 different parks. We had an amazing time. And the Karen Wellington Foundation definitely had somebody personally come to our house to deliver the vacation. I mean, it was just well thought out. And it impacted me so much because during the time when I was going through cancer, our lives had revolved around appointments and chemos and MRIs and scans. And this was just a time for us to break out, have fun, create memories. And my son at the time when we went, I believe he was 4. And even to this day, when like the Disney World commercial comes on the TV, he's like, "Mommy, we went there. I rode that ride." So it's just, the best part about memories is making them. And that's definitely what the Karen Wellington Foundation did for my family. So now it has impacted me so much that I recently joined their recipient ambassador board. And there's a lot of work, and maybe Bree can attest to that we're doing and plan on doing to continue to give families that same joy and peace and just break and relief from the everyday stresses that a cancer diagnosis can provide. So I'm just happy to be blessed to be a part of the Karen Wellington Foundation. So.
And yeah, when Bree, I know I would love for her to share a little bit more about how she even got involved and what, how everybody else can kind of get involved. But for me, it was, hey, I want you to be a part of this. I feel like you'd be great for it. And I was like, if Bree asks you to do something, you just show up. That's really that's just kind of how it works. So I did. And I think
again.
Oh yeah, no, but in the best way possible, because when you've got women who want to support women in this space, that there's something really powerful. And for me, I've always been a big proponent of research, and I still am, and I absolutely give in that space. But as a part of the mission of everything that I'm trying to do here with WISE, it really is all about transforming your life through the power of positivity and purpose. And there is not an organization that I know that does that and fulfills that more than the Karen Wellington Foundation. And the more that I'm getting to know Alexia and Kent and know the, all of the people that are on the board, and especially meeting women like Micky and other recipients, it's just been, gosh, so fulfilling. It was like the most unexpected thing because I just said yes and I just dove in, and it's been really, really great. So Bree, I don't know if you want to share in the last couple of minutes just a little bit about your journey with Karen Wellington Foundation and how it's kind of changed your perspective, and a little bit more about how people can get involved.
Sure. Well, I mean, it's always a blessing when you have a friend who's willing to sort of jump in and say yes. And I'm glad that you did, Stevie, to the Karen Wellington Foundation. Now more than ever, it's so important to, focus on self-care. And we're women in general are so burnt out with the personal and professional demands, whether it's virtual learning and jumping on Zoom calls late at night for work, or, making sure you're texting your clients back, emailing them back, answering their voicemails. It's hitting us from all angles. So, and part of that is just being your own health advocate as well. And I think that's the consistent message that we're hearing is, if something doesn't feel right, speak up. That's, how both my mom and my mother-in-law found their breast cancer was through self-exams in the shower. Something didn't feel right. And I don't think either of them expected to receive the news that it was in fact breast cancer. They were just in their mind being cautious. And so, all of the tips that Kelly is providing and that Micky is sharing with her personal stories, I think it's so important to do something, take action, because nobody's going to be a health advocate on your behalf. You have to make those steps forward. and 1 in 8 women, that's a big number, right? So we have 17 women on this call. I mean, so that's, something to really think about is, okay, be my own health advocate, make sure I'm stepping in the right direction. And obviously we're in the midst of COVID and a global pandemic, but speaking from personal experience with Christ as well, they are taking every precaution to make sure everyone feels safe and that all of the whole process is clean and you feel good about that. So, but going into the Karen Wellington Foundation, I think the premise of the whole nonprofit is really to add fun to the calendars of women who are living with breast cancer. And I always got this correction from Kent Wellington when I would say, oh, they're battling breast cancer. And he's like, no, they are living their best lives, and we're going to help them live their best lives through this journey. And so kind of as Micky said, hey, I wouldn't have chosen to have breast cancer, but I did the best with my circumstances. And now I'm here to speak about it and empower other women that they can get through it as well. And so what we do truly is have the give first mentality. It sounds tacky, but anyone on this call, if you know someone that has breast cancer, friend, family member, colleague, put them on our nomination list. Get on the KarenWellingtonFoundation.org, and Stevie hopefully will send out the link. Nominate them for what we are now doing as Fun in a Box with COVID. But it basically, in your nomination form, you'll say, hey, my best friend is Micky. She really enjoys being outdoors. She loves hikes and cycling and fishing. And so we'll create sort of a curated package for something that they can do that they really, really love, and hopefully do with their family as well. So in any other time, it would be really luxurious spa days, and beautiful vacations, trips to the mountains, ski trips to the beach. Currently, obviously, the environment that we're in, we're trying to really navigate COVID and not we don't have a ton of travel booked at this time, but we're hoping to get back to normal here once we have a vaccine, whenever that may be. So get some people on our nomination list, and really the goal is let's put some fun on the calendar of women and their families going through the most difficult time in their lives.
And there's a question, Bree, that Janet submitted. Do the nominees need to live in Cincinnati?
So we actually have chapters. We have 9 chapters at this point across the country, and it's all people that have been inspired and have said, oh my God, my cousin was nominated. She lives in Ohio, and I want to start this chapter in Illinois. And so we now have 9 chapters, but I would say the answer is no. They do not need to live in Cincinnati. Just make note of where they do live, and we'll find a creative way to get to them. There is a waiting list at this point, but I will tell you from personal experience, a friend nominated their mother-in-law last week, and the next day they received a response. Tell us more about her. We want to learn. We're working on this. Stay tuned. And so you won't get basically a no response when you nominate someone. We'll get immediate information, and then we work our best to make sure we get to everyone on that list.
That's amazing. Oh my gosh. I like I said, I know that we are just so fortunate to have this organization within our greater region. I'm really happy to hear that it's growing. I know for me, I learned about Pink Ribbon Girls when I lived out in Los Angeles, and it's just like the way that the support has been growing in a multitude of different ways. I think that for the Karen Wellington Foundation, we're going to continue to find that this philosophy of just empowering and inspiring people who are living with breast cancer and supporting those that they love the most, really supporting them along this journey is really crucial. So Thank you so much for Bree and Micky for sharing your stories of just engagement and of how you've really inspired so many people. To Ashley for sharing with us all about bra construction from a fashion designer. I hope that everybody took away something incredible from that. I know that I did. Like I said, having studied fashion design, it's a little bit of I'm a little embarrassed sometimes to admit that I didn't know those things, much less like be a woman that's been wearing a bra since, I don't know, she was 12. So I think that there's a lot there. And then Dr. McLean, thank you so much for debunking myths for us. I think that, like I said, for me, when you say surgeon, and sometimes it can feel so daunting, and you just make it really accessible and conversational, and I'm just really grateful for that, because I think it can kind of sometimes be scary to talk about breast cancer, and what we're trying to do is just have the conversation about breasts. Let's have the conversation, let's debunk the taboo, and let's have more open and honest conversations just with one another. So I wanted to make sure that I announced a few of so we have 3 winners today for our giveaway to Knickers in Hyde Park, and I will get in touch with you if you registered. So the first winner is Tria Brownfield. The second is Miriam Hemigdon. I'm gonna butcher that, but you know, I love it, and don't knock me because hopefully you love Knickers. And then Victoria, it's just like Cher. She doesn't need a last name. So Victoria is the winner. So with all 3 of those, I will be in touch with you, and we'll make sure that I find a way to get that gift card to you. The last question that I have is, Kelly, were you able to find an answer for that? Our candles.
Yes. Don't break our hearts.
I know.
So yes, I did find an answer, and the answer is probably no for breast cancer. Things to keep in mind is things that are lavender and tea tree based can actually cause gynecomastia in young boys because of the estrogen in them. So again, the whole idea of fragrances and candles is that, so for instance, this is the same concept with parabens and deodorant, that they do contain estrogens in them. So the idea is if you're applying them or aerosolizing them, that you're absorbing the estrogens. In reality, it probably isn't a high enough dose to cause any changes, and any studies that have been done probably have it at a much higher dose than you're getting exposed to.
Okay, that's great. So, because my takeaway here is like, rid the house of lavender for my son. So, well, again, like, I'm just so you know where my head's at. So I think that, but thank you for adding in that little, like, the amount that it probably is in is probably fine. Just, no, that's great. Well, I really appreciate everybody's engagement. I really appreciate you guys throwing in questions and being vulnerable and asking. Thank you so much to everybody who joined and spent and hung in that hour and a half with us this evening. I look forward to seeing you guys more at Wise Wellness Guild events. If you are not a member of Wise Wellness Guild, we are offering the first month for free. It's just, you can follow the link at the link in bio of our Instagram, or I'm happy to send that out with a follow-up email. It's $6 a month after that, and we give you access to tools like Enneagram, DISC, a lot of self-awareness tools, as well as access to thousands of wellness experts. So we're really trying to build ourselves as the Etsy, the curator of all things wellness. And that means not just healthcare, but also financial literacy, career health, mental health, all the 8 pillars wrapped into one. So you can learn more at wisewellnessguild.com. Thank you so much for spending your evening with me, and be wise and well. Thank you.